Catherine, for those of you that I didn't meet a little bit earlier. I am the local Itsero rep for this area, so this digital scanner. Very excited to come in and meet you guys tonight and just introduce you to intraoral scanning, and hopefully when you guys graduate and are out in practice, you will be getting to work with one of these because it's amazing and so much simpler than taking impressions. Has anybody worked with one or seen one before? Anybody had braces and had the orthodontist use one on you? No? Yes?
Ari has.
You guys did? Okay, awesome. How did that go?
It was okay.
Just okay? Well, what do you mean? Why just okay?
I don't know.
Still something in your mouth?
I have a band in my mouth.
Oh, okay. Well, hopefully it was a better experience than biting into the goop. That is the idea with these scanners, is that in practices now, this replaces about 90% of the impression material in offices. So rather than taking a traditional impression for a crown, a bridge, night guards, any different procedure, offices can now use this technology to make it all digital. And the idea of that is it is a lot more comfortable for the patient because you're not having to have them bite into that big goopy impression where they're gagging and it's a pain for them, but it's also a lot easier for you guys. I actually used to be an assistant before I worked at a line, and I hated mixing impression material and taking impressions, probably because I wasn't very good at it, but still, it's just not fun for anybody. So the idea of this is to help everyone make your lives a lot easier. That being said, the technology came out in, I'd say, the late 90s. So the digital scanning technology has been around for a long time. This isn't anything groundbreaking or brand new, but of course when it first came out, it was the very early stages where it was slow, it was difficult to use, it was very expensive. It's kind of like when we first came out with cars in the 1910 or whenever that was. I don't know the answer. But as the technology's improved, it's just gotten a lot better, a lot faster, a lot more accurate. And so now we're seeing a lot more offices start adopting it. So at this point today, we're seeing about 65% of practices start investing in digital scanners. And over the next, I'd say 3 to 5 years, we'll probably be closer to 90%. Just because as patients now go into offices with scanners, going to another practice that doesn't have one is like, what do you mean you're just trying to put goop in my mouth? Don't you have that camera thing that the doctor down the road has? So just because of that, patients are going to start demanding it, and that's what increases the adoption. Any questions about scanning versus impression material, the industry as a whole, before I dive into Itsero, how these work? All right, awesome. So this one, like I said, this is called the Itsero. This is just one brand. There's lots of different scanners out there. You'll hear offices talk about Itsero. They'll talk about the 3-shape trios. They'll talk about the CIRAC system. So lots of different versions of them. This is just the particular line that I represent. What's really nice about Itsero though, and why offices really like it, is because it's very easy to use. So when you log into an Itsero, this is what the screen looks like. No matter which Itsero, which version, they all work the same. And Apple was actually a consultant for us on helping design the workflow and the interface. So that's why you'll see the screen kind of looks like an iPhone with just big buttons and designed to be very intuitive. So if you are in a practice with one of these, ready to take a new scan, just very simple enough, we will select new scan. Want to make it easy. There's just 4 steps to complete a scan. So step 1 is you'll fill in the prescription, telling the scanner who you're scanning and what type of case this is going to be. Step 2 is to actually scan, so we'll capture the images. Step 3 is to review the scan, make sure everything looks good. And then step 4 is to send it off. So I'll scan myself tonight. So I'll search for me since I'm already in here. That's the patient. Then you select the case type. So if you're scanning for a crown, bridge, any restorative work, we select restorative. And then the office would add any labs that they work with right to the scanner. So that way, directly from the scanner, they can send this to any of their Crown and Bridge labs, and that way they can design everything digitally. There's no more lab slips and boxes and dealing with the snail mail. It's just all automatically sent off. So they put the lab up here, and then they'll come down, they see this whole chart, and they can select which tooth they're working on, what type of restoration they're doing. So if they're doing a crown, they'll say what material this is. A lot of offices are doing zirconia nowadays, is very popular, and then they just give it a shade. So again, this is just everything that would be traditionally on a lab slip. Now this just all goes into the scanner, so the lab can receive it all. I'm gonna scan myself tonight as an eye record. This is what you would scan for doing like a night guard or a whitening tray or Invisalign aligners, something like that, where you're just taking a full record of the patient's dentition, not worrying about any sort of restorative work that's going on. So that's what I'll do tonight. Once you've filled in everything on the prescription, we just jump to that step 2, which is to scan. So this is the wand for the Itsero. Like I said, there's lots of different scanners. They all look a little bit different, but the structure of them all is pretty much the same. With this little blue sleeve is my protective covering, because all of them have some sort of camera, some kind of lens on them, and it's very, very fragile. I won't shine this in all of your eyes right now. But as you can probably imagine, it's just like a very sensitive camera lens. So that's why we leave that protective sleeve on, and then we place a new protective sleeve on for every patient. So these get tossed after you've scanned. All right, so here is our scanning screen. This little model up at the top corner, that's telling you where it's expecting you to start scanning. So my lower is highlighted in blue here, so I'm gonna start on the lower. If you wanted to scan the upper, you just select the upper. Very, very simple. Down here, this little black box, this is the live feed. So that's showing you whatever's currently in the view of the scanner. It's not actually scanning, just telling you where it's pointed. And then what this is going to do is build a 3D model in the center of the screen as I move it across my teeth. So one of the things that's really nice about Itsero and why I think it's easier to scan with is it's actually a contact-based scanner. And all that means is while I'm scanning, I'm actually gonna be touching my teeth with the wand head. So you just place it right on the patient's teeth and just move it right across their arch. Other scanners, you have to hover like 5 or 6 millimeters away from the patient's teeth and keep this nice distance away so it can capture it. I think it's easier just to place it right on there to kind of have a tactile sense and a weight. So we do recommend workflow-wise to scan the occlusal surface first. That just builds a really nice framework for the arch, so then you can roll to the lingual, roll to the buccal, fill in any other areas from there. So I'm gonna scan myself. Do a little air floss.
Is that cool or what?
Yeah.
So this takes the place of the alginate impressions you guys have been working on.
Mm-hmm.
And there's other cool features with this. The wax bites we talked about with the bite registration, it also does that.
So just like that, we've got a whole 3D model. No goop, no mixing
goop.
anything, none of it. So much simpler. So what is really nice about the Itsero is that you'll notice here, these blue spots, those are holes. So it's telling you any section that you didn't get good data. Because one of the things that's sometimes hard with impression material is, how do we know if this is gonna be a good impression? Did it distort? Is everything captured? With Itsero, it very easily highlights and tells you, all right, this is good, or we need to go back and fill in some more areas. How these scanners work is these are capturing thousands of images every second as I'm scanning, and then it stitches those images together to give you this final 3D model. So what's interesting is if I were to go back in and just start scanning over any of these sections, what happens is something called over scanning, because the longer you're scanning, the more images it's taking, because 6,000 images a second. And so then you would think that the more images would make it more accurate, but it actually doesn't. The more images you have, the scan starts to get kind of fuzzy. It's almost like paint. You want one crisp, clean layer of paint, and then if you start building layers on top of itself, it starts to get kind of fuzzy. So what's nice is with Itsero, I can just hold onto this screen, select fill, and it'll highlight any of these spots that I missed as holes. So when I go back to fill these in, it will only let me scan in these areas, and I'm not gonna overscan any areas that I already have good data. Does that make sense?
Mm-hmm.
I know it's sort of a weird concept. So I'll try and show you how to fill these in. One of the things that's nice is it's pretty good in a moist environment. Like I didn't use suction or dry my teeth or anything. It does not see through, I say, full puddles and bubbles. So if you have real saliva accumulation, you just hit it with a little bit of air and then the scanner will pick it up. So I know some of these blue spots, they're the same ones I had earlier today. I just tend to accumulate some saliva here, but I'll do my best. Pretty good considering no air. So that's my lower. We'll do the exact same thing on the upper, occlusolingual buccal. All right, and then what we were talking about is that you can also capture your bite this way. So that's the last step, capture the bite. I like to use the wand as a cheek retractor. Then you'll have the patient bite down and then start scanning. If you start scanning before the patient's in occlusion, it'll try and capture the movement and it just gets a little wonky. But I'll use the wand as a cheek retractor, then start scanning, just kind of wave it up and down. You do want to capture a couple millimeters of gingiva as well, but you'll see the two arches come together. That means you've captured your bite. Just like that. And then whenever you do a full mouth scan, you of course want to bite on both sides. And like that. I just started Invisalign this week, so you'll see I have all these little, my attachments, very sharp. All right, so once we finish the scan, last step, that's when I post-process. That's where it's officially stitching those images, giving us this final model. And you can switch this between stone and color. So depending on what you think is the best viewpoint, personal preference. And this is where you come in, check and see, is everything filled in? Are there any spots that we need to go back in for this particular case? And then you can just jump back, use that fill mode to rescan. Or if everything looks good, then you just press that send button and it automatically goes to the lab. So like I said, no more paper, you don't have to box it up, sanitize everything. It's just automatically sent off. But what's really cool now, and what we also have offices starting to use scanners for, is rather than just scanning after the patient has said yes to the crown or the night guard or whatever procedure it is, they're starting to scan more proactively and then using the scans as a patient education tool. I'm sure you guys talked about intraoral photos and how you can use those to also show patients what's going on with their dentition and why you're recommending treatments that you are. The scanner does kind of the same thing, but almost, I say it's like an intraoral camera on steroids, because now we add these really cool applications to it. So how this works is right when you finish scanning, patient will see the model. So right off the bat, it's a great patient education tool because people aren't used to seeing their teeth in this way. So right away, they're gonna start asking, is that really what my teeth look like? And start maybe coming up with some treatment ideas and co-diagnosing with you and the doctor. But what you can also do is use some of these tools, like this one I love, it's called occlusogram. If I click this little rainbow, this pulls up a heat map of the patient's bite. So if you're talking to them about a night guard or maybe why they have restorations that keep chipping, you can pull up this occlusogram and actually show them that anywhere that there's red, that means your teeth are coming together too hard here. And that's why we think that a night guard would really benefit you, or that's why these restorations that you keep having to have redone keep failing. Your teeth are coming together too hard. We need to correct that first. So that's occlusogram. I love that tool. I am unfortunately a very good example of the need for an occlusogram. I have, you can see if I switch this to stone even better, some really bad wear on my lower canines. And my dentist was talking to me about needing a night guard for a long time. And I am a very classic patient that you guys will see all the time that tells you they're not grinding and they don't know what you're talking about. They don't need any sort of night guard. And that's where it's nice because you add this tool and there's no denying that she knew what she was talking about, and there's definitely something going on here. So I'm doing Invisalign to get my bite corrected, and then I still don't think I'm grinding. I think I'm clenching, but still, we got to get that work done because that canine's getting a little jagged. And I do know that that's only going to get worse if I don't do anything about it. So that is occlusogram, one of my favorite tools. What's neat about this model, like I said, every scanner is a little bit different, has different features and functionality to it. But this one, at the same time that I just scanned, it also took all of the intraoral photos at the same time. So if I click this little blue tooth, it'll isolate one arch and bring up this magnifying glass. So when I drag this along the arch, that's all my photos. And from every different angle. So it's not just building that 3D model, it's also actually taking real photographs. So what's handy now in offices is if there is something that they want to show the patient, or also that they want to send to insurance as part of a claim for why they're submitting for this particular procedure, they can take a screenshot of this right on the machine, and then they can mark it up and draw, all right, this is the spot that we're worried about, this is why we're recommending this procedure, here's where it is in the mouth, and then they can even type on it saying this is going to be a class 2, whatever it might be, and then they can send this home with the patient, or they can send it off to insurance as well. So kind of nice, just designed to make your lives easier with only having to do one step with doing a scan rather than doing scan and taking all these intraoral photos. But also really handy for the administrative team at the office as well, that they have all of this right at their fingertips to send off to insurance or wherever as well. One more tool that I wanted to show you that I love is called timelapse. So like I mentioned, what offices are doing now is taking a more proactive approach to scanning. So what that looks like is sometimes scanning as part of the new patient exam. So when a new patient comes to the office, as part of that comprehensive exam, they'll take a scan, and that way now they have it as part of that patient's chart. And that way, when the patient comes back in 6 months later or a year later, whenever, the office can scan them again and now show the patient what's changed between that first appointment and now when they're here. So how they would do that is they click on patients here, so one of our simple 4 buttons. They can pull up that patient's chart, just search for their name, and then they would select 2 scans. So this chart will have all the scans that that office has ever taken on this patient. They just select 2 of them, and then they can compare them. So this will show any physical change that's happened between these 2 points in time. So we'll show any tooth wear if somebody's a grinder like me, any sort of tooth movement as well. So really nice for sometimes showing as things are getting better, like if somebody's in ortho and they come in and say, my teeth aren't moving, now you can actually show them how much they have progressed, because sometimes it's hard for the patients to see when they're looking at their teeth every day. But it's also really nice for gingival changes. So you can show a patient when they've started to have some recession, it'll show that as well. So time-lapse, it pulls up another heat map here, kind of like that occlusogram, but this time, anywhere that there's color, that means there's been some sort of physical change between these 2 scans. And then the scale over here tells you just how much. So what you can do now is drag this magnifying glass and move it over to any of those areas that had that change. And this image in the corner is going to toggle back and forth between the 2 scans. So you can show the patient, here's what you looked like a year ago, here's what you look like today. Catherine, I know you say you're not grinding, but something's going on. Is that pretty cool?
Yeah.
Where would this be really useful? Between a patient and a dentist?
Orthodontist?
Well, in any type of specialty. If a patient says, my teeth are worse off now than when I first came in here.
Mm-hmm.
A lawyer, yeah. I was part of 2 different cases for the 10 years that I worked with my orthodontist, and we won both because we had the proper charting and regular pictures. But imagine this in a courtroom. That'd be really great.
That's a good point. I haven't thought about it in that
Yeah.
sense. Luckily, nobody's asked me about it in that sense. So, knock on wood, that's a good thing. But yeah, no, that's absolutely right.
Yeah, because everything's time stamped and everything.
Yeah, no, it's all locked in here.
How long is the information stored?
That's a great question. So again, every scanner out there is a little bit different on how those types of things, how big the hard drive on the unit is. What's really cool with Itsero is the hard drive on here can hold about 100 scans roughly, but what's nice is everything is cloud-based, which means as soon as I finish scanning, it also uploads to the cloud. And the reason that's so nice is because I'm not storing thousands of scans right on here. It's kind of like, you know how on your iPhone now, has anybody noticed this? You only have so many photos that are actually stored on your phone, but then when you go to open something, it looks like it's on your phone, but it takes a second because it's opening up from the cloud. It's the same concept. So they're all on here. You can have as many scans, there's no limit. It just has to be connected to Wi-Fi, so it will open up, essentially. Does that make sense? The real reason that having it being cloud-based is so nice is kind of 2 things, actually. Number 1 is those scans now aren't clogging up the doctor's server. So every office will have some type of server where their files are stored. These files, they're typically called STL files. They're very, very large. It's like, if you think about a JPEG and how much space that takes up, multiply that by a lot. I don't know the exact numbers, but they're really big files. And so what's nice now is if the doctor is having to store all of these files on their server, they typically don't have space for it, so they have to upgrade their server, which is of course an expense. So what's nice with the cloud is they're stored in the cloud. They don't have to worry about it being on their server. They can download them if they want to add certain ones so they can review them later or do something with it. But you absolutely just can leave them on the cloud. Why it's also really nice though is with that proactive approach to scanning, what happens is these become very high demand in the office because the hygienist wants it because they have a new patient they need to scan, the doctor and the assistant want it because you have a crown prep you need to scan, if there's another doctor in the practice, they're wheeling up and down the rooms a lot. And so what's nice is for the patient education tools, you don't actually have to do this on the scanner. You can just pull up that cloud website on any device, on a cell phone, on an iPad. If the office has monitors in the operatories, you can pull up anything and show all of these scans. All you have to do on the scanner is scan. Everything else can just be done on an iPad or something like that. So that's what's handy too, is because now they can get a lot more out of one scanner. That's why proactive approaches work with the Itsero rather than having to need a scanner for every operatory, because that wouldn't make financial sense in most cases. But that's a great question, because yeah, the cloud feature is kind of new and it's pretty cool.
I like this upcoming feature with the interproximal.
Oh yes. So what's also nice about this one, I showed you, it does, at the same time that I scanned, it took all of my intraoral photos, but this one is also doing interproximal caries detection. So I'll show you how this works. I'm just going to search for a patient here, bring up the viewer tool. This is how you'd view any previous scan, either on the scanner itself or on that cloud website I was telling you about. While you're in viewer tool, you can pick which view you want to see. If you want to show the patient their teeth from both arches, you can add the occlusogram to that. You can even show them all 5 different viewpoints. So kind of looks pretty cool when you have this up in the operatory.
When we get into orthodontics, this is the layout that most orthodontists use to show their patients before and after to dentists.
It's pretty cool. But, so same as before with the photos, if I click on this little blue tooth, this is doing interproximal caries detection. It's called NERI, which just means it's a non-ionizing radiation, so it's perfectly safe to use on anybody as frequently as you want, children, pregnant women, anybody, NERI safe on. But how it works is it is sending this non-ionizing radiation through the tooth, and it's basically the opposite of an x-ray. So typically on an x-ray, we're looking for those dark triangles to signify that there's decay. On the NERI, we're looking for a bright white spot. So healthy enamel, I'll show you a healthy tooth. Healthy enamel is going to appear dark. It's the darker outer ring. Dentin will reflect the NERI, so that's why it's the white spot in the center. And then decay is going to scatter the NERI. So like I was saying, we're looking for those bright white spots within our healthy enamel. So on any arch, you can just grab this little magnifying glass and you just drag this over, looking for any bright white interruptions in the healthy enamel. Just like that. Does everybody see it? Mm-hmm. And what's nice too is just like an x-ray, you can adjust the brightness and contrast on this to help you see if there's something going on here. And this is why NERI is so cool, is because it's very helpful for the doctor, since this is just for class 2 and class 3, so our interproximal decay, which can be harder to see on bite wings just because of the placement of it. And so the NERI is really helpful for them in just aiding in their diagnosis, but it's also really helpful going back to patient education, because radiographs are hard to read, and they're hard enough to read as clinicians, but then from a patient perspective, they don't know what they're looking at if the doctor's trying to explain why they need some type of restoration or procedure. And so this is much more obvious even to an untrained eye. And so same as before, I was telling you, they can take a screenshot here, you can take a screenshot and start marking this up and say, all right, Mrs. Smith, this white spot here tells me that there's probably going to be a little bit of decay here. Doctor's probably going to recommend that we do something about that, and start just adding to that conversation with a visual. And then this all ties to the photos too, so you can draw back on here. It's neat. I mentioned I used to be an assistant and I really struggled with impressions, but what I also sometimes struggled with was having a patient that I'm presenting a treatment plan to and they don't understand why they need it. They're telling you that they're not in pain and they don't understand, they don't see anything wrong. And it's tough because you know that they need whatever work it is. The doctor knows it's absolutely the right thing. But sometimes it's hard when they just don't understand it and they don't value it necessarily too. So all of these tools are just designed to help with that. I relate it now. I have been having some car trouble lately, and I hate going to the car dealership because I don't know anything about cars, and I always feel like they're telling me I need X, Y, and Z, and I don't know if I actually need X, Y, and Z, or are they just telling me I do so they can hit quota for something or whatever it is. And I think a lot of times patients feel the same way when they go to the dentist, and it's not because any dentist is trying to prescribe something that the patient doesn't need. I mean, no, every dentist that I've met, I really do believe is a great person, and nobody's trying to do anything like that. But from the patient's perspective, they don't know. They don't know what the radiographs are looking at. It doesn't hurt them, and so they genuinely just don't get it. So it's kind of helpful, and I wish that my goal is to find something that I can create that'll do the same thing for a car dealership, and I can retire. So it's pretty cool.
Any questions? No? All right.